We move on to mold here. You mentioned that a little bit. Signs and symptoms of mold can also be very vague. Chronic fatigue, migraine headaches, weird allergies, rashes, chronic asthma, etc. Elevated eosinophils, potentially. Right? Anything else? Chronic cough. I've also noticed children having sleep apnea, snoring at night, trouble breathing, right? Have very swollen turbinates. Fatigue, joint pains, they're always so common. The joint pains are chronic with these people.
Yeah, headaches. It's a big one.
Headaches, migraine headaches.
Does anyone know with mold? I mean, there is mold exposure that people have, after flooding or things like that. Do does anyone know if some people are just predisposed to like to sensitivity with mold? If there are any specific genetic markers that we can know if someone is going to be predisposed to sensitivity, because we just had a couple that the wife, has chronic Lyme, and I think she mentioned also being sensitive to mold and stuff, and she said that, and the husband was saying he can smell anything, he can be around anything, etc. And it doesn't matter, and it doesn't touch him. So do you guys know any of those things? Is there something that we can? Oh, okay. I think Patty is saying HLA sensitivity testing. Would that be in general for chemicals, um, or for mold, even more specific?
I don't
And
know. I
you
mean,
can talk.
I test people, with a small amount of uh, penicillin sometimes, just to see if they will have some kind of a hapten reaction with it. That's not really very mold specific, but if they're sensitive to penicillin, they're probably going to be sensitive to mold and fungus.
Whoa,
Hmm.
what's a hapten reaction?
That's where because penicillin's a fairly small molecule, but if it combines with one of your proteins in your serum, and your body recognizes that as foreign, you can have a reaction to it. Even though penicillin per se is not a protein and really shouldn't trigger an immune reaction, if it binds up with those proteins, then you can have a abnormal reaction to it.
Well, a lot of people
Hmm.
say they're allergic to penicillin. I mean, how do you differentiate just allergic to penicillin to this reaction?
Well, they're all to some degree that, the cause of that. If it was worse, it'd be anaphylactic, but you could have
Hmm.
anything from that to a delayed hypersensitivity type 4 reaction. I mean, it may be 2 or 3 days later.
It's pretty cool. I use serum antigen or antibody testing with my Myco labs. It's a blood analysis. Probably the better way to test it rather than the urinary metabolites, which I've done as well, but that's just an imperfect excretion of mycotoxins.
I think there's one of the interleukin markers that I'll have to look it up again, but I want to say it's IL-23. I'm not sure
Hmm.
though. Don't quote me on that. But sometimes with mold or fungal infections, those will come back positive.
IL-6.
No, it's IL like 20, 22, 23, something up in the 20s. I don't know.
Yeah, okay.
I really, I'm just doing that kind of off the cuff, check
Sure.
up on it, but maybe do a search for um, interleukin reactivity with mold sensitivity.
Cool. I've attended a few seminars with Dr. Andrew Campbell. He's like a mold specialist. He likes to use Sporanox or itraconazole a lot to treat mold. Have you guys used much of that?
No,
So
I've not.
is Sporanox just the brand of itraconazole?
Correct.
Is that the same thing?
It's the same.
Oh, okay. Yeah, we are using itraconazole fairly regularly.
Good.
I know Jake was saying basically Sporanox like just 7 days. I'm not sure, you know, I'm not sure if that is going to be enough, right, for
Yeah.
some people, but he's combining with other things too, though.
Yeah, that's true. There's a lot of supportive therapy that Dr. Campbell advises to help with some of that herxing and that neurotoxicity that happens from release the die-off. And he recommends like melatonin and B complexes and
I
magnesium.
like, I like berberine too.
Berberine.
Yeah, Metagenics makes a product called Candibactin BR that's got berberine in it, used for primarily sinus problems.
Yeah,
related to fungal.
There used to be a compounding pharmacy called Hopkinton Drug in Massachusetts. They were specialists in developing treatments for mold. And one thing they would develop would be voriconazole intranasally. And they would use that to treat the biofilm of the sinus cavities that a lot of these people get from the mold.
Wow.
Yeah, I sat in a lecture with ENT who actually does sinus irrigation with antifungals for people with severe mycotoxin infections of the sinuses.
Is he primarily seeing those in people that are immunocompromised or that have diabetes or
no regular folk?
No. I don't know. I think everybody wants to go on an antibiotic, but I think that kind of maybe predisposes you to that normal flora imbalance to the extent that you may be more subject to infection with fungal.
Well, you're suggesting that antibiotics can make the mold toxicity?
Yeah.
Oh, of course, yeah.
Yeah. Patti, you're putting all kinds of good stuff in there. Feel free to chime in and so we can hear your wisdom too.
Yeah, Patti, I can't even see your notes because I'm screen sharing. But
you put something about a BEG nasal something. I've never.
Yeah,
it says how do I talk? Just make sure that you're not muted.
Yeah.
And yeah, you're muted right now. So just unmute yourself and speak up. Just if you click on the thing, I don't know if you're using a mobile or a screen, you can see the little mic. There you go.
Got it. Can you hear me?
All right.
Yeah.
Gosh, this is so awesome. So the BEG, which is the Bactroban ED, EDTA and gentamicin is the nasal spray that Hopkins, yeah, they can make that when you can do the nasal swab for MARCoNS, which is the multiple antibiotic resistant coag negative staph infection that people get in the nasal cavity when they're exposed to mold.
Cool.
I heard Hopkinson's was bought out by PD Labs. Is that right?
Correct.
Yes, PD Labs in Texas used to be like a sister pharmacy with them. Jim Laval, I don't know if any of you are familiar with him. He's wonderful. If you ever have an opportunity to have him speak on anything, he's amazing. But he's the one that came up with that initial formula that they were using. But Hopkinton couldn't ship to very many states. I know they wouldn't ship to Tennessee, so I had to use PD Labs on that. But they're really good.
Cool.
Yeah. Wow. I never heard
for
of that.
A lot of those specialty.
Thank you, Patti.
Yeah, absolutely.
So this week I had some particular success with this lady. She's been having chronic asthma, so severe asthma exacerbations multiple times a week, and not actually better with conventional montelukast and albuterols, etc. But she had the first relief she ever has. So she would get multiple asthma exacerbations multiple times a day. But I gave her an injection of thymosin alpha 1, and I gave her glutathione by the company named of Numi. And for the first time in like a year, she only had like 1 or 2 or 3 asthma exacerbations during the week. And so
Wow.
the thymosin alpha 1 is a very potent peptide that I like to use for these people who are, I'd say, immunocompromised. And that's what I think a lot of mold is people do have weak immune systems, and so they're more sensitive to mold, as Raphael pointed out. They're more sensitive to it. They smell it. They can enter a house and they can't bear it. They have to get out. They have the multiple chemical sensitivity. They're more sensitive to it. I think it's because their toxic bucket is full. They're more sensitive to it.
Yeah, absolutely.
Yeah, that's how my wife is. We rented an Airbnb in Asheville a couple of years ago, and within literally 1 minute that we come into this kind of old quaint house or whatever, she just got a horrible headache right away. She kind of smelled something funny, and I mean, me and the kids, we were fine. We were gonna just kind of ride it out, and she just couldn't tolerate it, and we had to find another place to be. Um, and she has just such um, a good way to smell things, that are not really triggering to others. And so yeah, she has a lot of these types of things. Not quite asthma, but she's had a lot of exposures. She's had a lot of different weird symptoms, and the doctor that I'm working with that has seen Lyme for many years, she suspects that she has underlying Lyme.
Yeah, Lyme and mold is one of those things. Once the spiral cascade down starts, you don't know what instigated the initial immune compromise, but once that pathway is opened up for inflammation and sensitivity, then, latent bacteria, viral infections can be reactivated. The immune system just isn't able to, handle that extra burden. So that's where it's challenging, because you don't know where to start, but you have to start someplace. I know Dr. Klinghardt used to say, start by treating, and Jake, you can comment because you know him a lot better. I don't know him personally, but he used to say, treat from largest to smallest entities in the body. So, viruses are going to be last on the list. You're going to start with parasites, mold, mycotoxins, work your way down, bacteria and viruses when it comes to treatment. But it's layer by layer, because you can treat one layer or go after one particular area or toxin, and then something else will manifest, like mycoplasma. You might not even suspect that the patient has that, but once you start treating mold or Lyme co-infection, then you're kind of opening up that can of worms, and you just have to keep going at it. And healing is definitely possible, but for some people it takes a very, very long time, and there's not any cookie cutter, one size fits all approach to treatment.
Yeah. I had a conversation with a patient today that was almost 2 hours long. And, he has done so much. He has seen these different, kind of famous doctors who treat Lyme around the country, who are, published and all that. And he has done so many different things. Now, I still could find some things that he hasn't quite tried yet, but one of the main problems that I'm seeing now for him, because he is, in his 12th year of fighting this, and he has basically no energy. He just gets up does like something like let's say laundry or will eat breakfast or whatever, and then he already has to come back to bed,
Yeah.
that his mindset is basically that of hopelessness, and he just doesn't even see that he can get better anymore. So I try to very gently, because I'm just getting to know patients, right? But I tried very gently to just put a little bit of light into the fact that the mindset can really either be helping us a little bit, steer toward the right direction, or it can be kind of, in a sense, being part of sabotage too.
Absolutely. Absolutely. That's a great point.
The only other thing you missed, Jake, was our treatment for mold, but we covered Sporanox. We had the interesting thing Dr. Tinney mentioned was you can use penicillin to see if they have a hapten reaction. This is a new one. Have you ever heard this before? This is interesting.
Penicillamine?
Yeah, you use penicillin in the patient you suspect of mold, and you can see if they get this immune response to it.
No, I haven't heard of that.
That's interesting.
But Dr. Richie Shoemaker, I took his course, and he has a book called Mold Warriors, and it's a really good book because some people have a bad genotype. They have bad HLA genes, and then they don't respond to mold treatments. So you do an HLA DQ and HLA DR test on them to see if they have the bad motherboards, okay, the bad genes for molds. So that's actually in his book. He has, in the back of his book, he has the dreaded genotype. So that's a great book to read, Mold Warriors. And he's got different protocols on how to detoxify molds, because molds can give you the same symptoms as Lyme disease.
Right.
Yeah.
And then in Port Arthur, when I was living there, my air conditioner got full of molds all the time. So I had an ozone machine. When I left, I would put the ozone machine on right next to the air conditioner to kill the molds.
Yeah.
I've got a UV light in mine because that's why I think I have this fungus. It's because I have mold illness, essentially, because I got mold in my vents, which I'm trying to get fixed.
Yeah.
Right, so Dr. Shoemaker is using cholestyramine a lot, 1 teaspoon usually at nighttime to help your body get rid of the molds. And then you can always treat the mold allergy. I've got a technique that cures allergies. So a lot of people, once you treat their mold allergy, they feel a lot better, even though they still have molds in their body.
Wow.
Pectosol C is another really good pectin fiber with a lot of great research on it.
What'd you say? I didn't hear you.
It's Pectosol C.
Oh, I don't have experience with that.
It's a pectin fiber. Cholestyramine, therapeutically, Dr. Shoemaker says, if you're not taking, 1 teaspoon 4 times a day, you're not going to get well. If you take it 3 times a day, you might get a little bit better. If you only take it 2 times a day, you might not really notice a difference. So you really need that 4 scoops a day. And it's hard on the GI. A lot of people can't tolerate it. Constipation and GI distress.
Can you take some magnesium with it?
Yeah. I mean, I love magnesium.
Yeah, just
for
keep
that.
your bowels moving. Yeah.
Yeah. But still, the acid reflux and the GI symptoms that go along with cholestyramine. But that's his number one go-to is cholestyramine. But there's the pectin fibers, there's zeolites, there's bentonite clay, all those different binders they'll attach to some of the mycotoxins, but there's not anything probably as well or does as well of a job as cholestyramine on a vast majority of the mycotoxins, because there's so many that you can have.
Wow.
But yeah, cholestyramine, and you can get it compounded without all the sugar.
Right, without aspartame or sugar.
Yeah, because that's
Really
just going to feed your mold. But I like Pectosol. I like the Zoe zeolite. I think that will absorb, because zeolite is like a the formation of it will suck in the toxins like a crate almost. It'll suck in the toxins and won't allow them to go back out. So then you can excrete them through the GI.
Sure.
So zeolite works, good for some of the mycotoxins.
Yeah, I'll use that in the biocidin protocol. So I'll put patients on that biocidin because a lot of them have the mold and the yeast overgrowth in their gut.
Yes.
So should people be drinking apple cider vinegar or regular vinegar? I don't think so when they have mold problems. What do you think?
They say that turns to the sugar and feeds it. Even though I really like apple cider vinegar for a lot of ailments, GI, but they say stay away from the vinegars when you have mold.
Right.
Interesting.
That's interesting.
Well, is it the vinegar or the apple?
I think it's vinegar.
I think it's the yeast.
In the vinegar.
The yeast.
Huh.
Yeah.
I'm not sure though.
Same thing with, mold or mushrooms. We know are so therapeutic for a lot of different things, but because they're a fungi, they say they don't even really recommend that.
What about cheese? You got to stay away from moldy cheese, I guess.
Yep, Roquefort and all those older cheese. Yeah, any of the cheeses.
And peanuts, right?
Peanuts.
Peanuts.
Yeah, aflatoxin.
Yeah, aflatoxin's a huge one. Corn, anything that can be stored in a bin in a warehouse has the potential for growing molds.
Right. So grains.
Grains.
Yeah, you got to get the patients off the grains and the corn.
Corn, all of that. Yeah, and the sugars and.
Yeah. Yeah. Do you guys use
have you guys tried the Spornox at 100 milligrams 2 BID or not?
Yeah, I've been starting to treat patients with this. Yeah, with mold and fungus. Yeah.
Yep.
I haven't had any liver problems for a week or 10 days doing that dose.
Yeah, no, I think it's a good drug to use. The other, do you guys have much experience? I think Patti has with the biocidin cleanse protocol. I use this routinely for a lot of patients.
No, I just do Spornox and Spornox and the turpentine. Usually that works, and the borax.
Okay, Patti, did you use it?
I have. I don't use it a lot. I haven't had too much success with it. I've used it for some of the patients that have been resistant to that BEG nasal spray for the Marcons.
Yeah.
I just have them spray the throat spray up their nose and back of their throat.
Yep. Yeah, I've used this protocol pretty extensively, and I've seen patients usually see a lot of benefit with this one because I feel a lot of people have bacterial and the biofilms in their gut, and this holds onto the fungus, candida, and they have a lot of GI issues. We do one cycle, 1 month, and you can see a lot of improvements in their symptoms.
Yeah, I know, but some athlete with tinea corpora that's real severe, I don't think it's going to work at all.
No, it doesn't work for that, but it'll improve their gut dysbiosis.
Sure.
Cool.